Hi, I'm Graeme, Chief Exec of SCMA. Yesterday, there was a really important document published in Scotland about the reopening of schools and childcare facilities. Now, there's been lots of information shared and circulated about this overnight from a range of sources. Potentially, there's a risk of information overload, duplication, but there's also a risk that you might have missed some of the key points and detail within this. But also when there's so much information being circulated that sometimes it can be conflicting or contradictory. What we'd like to do is try to provide as much clarity as anyone can at this time. So please, if you're going to access any information about this over the next few days, please watch this video. It'll take less than 10 minutes of your time, and it'll hopefully provide you with as much clarity as we can at this time from a childminding perspective. So the document that was published yesterday by the Scottish Government was referred to as a route map. It details how we will emerge from lockdown over the coming weeks and months. It describes how we'll move from the current position of lockdown through 4 key phases as social distancing measures are gradually relaxed and as a range of activities are gradually reintroduced. So there's lots of detail in the documents covering all aspects of life, from childcare and school to work, leisure, shopping, attending church, the reopening of recycling facilities, and lots of things in between. I'm not going to attempt to cover all of that, it wouldn't be relevant, so we'll just pick out the key points for you as childminders. So the first thing to be aware of is that all childminding settings and all fully outdoor nurseries in Scotland will be allowed to reopen in phase 1. Now, I'd stress 3 things about this. At SCMA, we are very aware that a number of you have remained open during the outbreak to support the national response. You've operated within existing public health guidance to provide critical childcare to key workers and vulnerable children. But what yesterday's announcement was about is it's much wider. It relates to reopening all childminding settings and not just on the reduced model of for key workers or vulnerable children. The third point I stress is that the precise date at which all childminding settings could reopen in Scotland has not yet been confirmed, and it's really important to be aware of that. Larger early learning and childcare settings, such as nurseries, will be allowed to reopen during phase 3, and that'll be during the summer. Critical childcare will continue during May, June and over the summer to maintain provision for key workers and vulnerable children, but that will then probably start to taper off as we get closer towards schools reopening. Teachers have been asked to return to work in June to start to prepare for the next school year, and schools will all return on the 11th of August, but on a blended basis, which will be part in school and part in home education. The balance of that and what it might look like has not yet been agreed, but that will be worked out over the summer. The Scottish Government has also asked local authorities, schools and nurseries to give thought to how they can support transition during the summer, particularly for children transitioning from nursery into P1. So it's really important also to be aware that this is not a definitive timetable, it's more of a framework. The route map itself is based on the latest scientific evidence. It will be subject to regular review, so things could change. It will take into account continuing progress in suppressing the virus. It will take into account the latest public health advice, but also wider progress in implementing test and trace measures. So when might things actually change for childminding? What sort of date are we looking at for reopening? Well, lockdown is next due to be formally reviewed in Scotland on Thursday the 28th of May. Phase 1 will only commence after that date if we continue to make good progress in suppressing the virus in Scotland. If the virus has increased again, phase 1 could be delayed. But if progress continues to be made in suppressing the virus, phase 1 will commence after the 28th of May. But it's really important to be aware that not everything will change on day 1 and at the start of phase 1. It's expected that there'll be different changes phased in throughout phase 1 itself. So for example, you could find that recycling centres or garden centres might open quite soon after the 28th of May, but other sectors and areas might take longer because of the planning involved to reopen. So to be absolutely clear, no one knows a precise date when childminding will reopen. It's not been agreed. But we do know it will definitely be in phase 1 and will also be ahead of schools and nurseries. So that takes me on to the next point. Some of you might be wondering, why is childminding being allowed to open ahead of schools and nurseries, and also when there's still social distancing in place in the wider community? It's a fair question. It's a good one to ask, which I'll try to answer. The first thing to say is that evidence on the virus is continuing to evolve. But there does appear to be general agreement within the scientific and medical community, nationally and internationally, that the severity of the virus in young children is less than amongst adults. There's also been a lot of the modelling of the impact of the virus in both at a Scottish level and at a UK level, which is now suggesting there's scope to relax some restrictions on childcare and education over coming weeks. So the next thing you might ask yourself is that, well, if social distancing is to be maintained in public, how could we make that work in a childminding setting? What we would stress in response to that is nobody is going to try and make that work in a childminding setting. It's not considered appropriate. It's been recognised it wouldn't be possible, and it also wouldn't be desirable to implement physical, strict social distancing between young children or between a young child and a key worker. But if we do wish to be able to reopen childcare, we need to develop age-appropriate public health guidance which will support the reopening of all childcare settings. So when we look to the evidence that is coming through from other countries where childcare has been reopened, we will be able to reduce the overall risk by focusing on 5 key areas of practice. The first is enhanced hygiene and cleaning practice. The second is caring for children in small groups. The third is minimising contact between these groups. The fourth is maximising the use of outdoor spaces. And the fifth is physical distancing between adults in the setting, and also including parents at drop-off or pick-up times. Now, as childminders, a lot of this might sound familiar, quite close to normal childminding practice. It's also far easier to do in a childminding setting than it would be in a much larger school or nursery. When schools and nurseries do reopen over the summer, it's expected that they will probably have to follow similar principles and models based on small groups. This is expected that it could reduce capacity in their settings and take more time to plan. So hopefully this might start to explain why childminding is being allowed to open earlier than schools or nurseries. Now, moving on, we're aware that many of you will have lots of questions about reopening for normal business. We certainly do. This could be, will you be allowed your normal capacity within your setting? What should you do if you're open just now and you're supporting key workers or vulnerable children and your usual families want to come back? How do you manage that demand? Will you have to make any other changes to your practice? We also anticipate you'll have lots of questions about financial viability. You may be in a position just now where some of your family's parents or carers are on furlough. They may not be looking for childcare. Also, if you were to reopen on a partial basis, you might be wondering if you're still able to claim some financial support to assist you during that period while you rebuild your business. Now, to be completely open and honest with you, we're kind of getting back into the territory that we were earlier with the virus, where no one has answers to all of these questions just now. Not SCMA, not the Scottish Government, not the Care Inspectorate. But what we can say is the Scottish Government has asked the Care Inspectorate and Health Protection Scotland to work together to develop some age-appropriate public health guidance which will enable childminding settings to reopen safely. Now, it would be our expectation that a number of the questions you might have around capacity and practice will be addressed by this guidance which will be developed. Clearly, questions around finance will be out with the scope of that. But what we will do, as we've done all throughout the outbreak, is we'll engage with the Scottish Government and others, and where we don't have answers, we will undertake to get them as quickly as possible for you. We're also currently involved at a national level, contributing to a working group on recovery. We're also working very closely with the Scottish Government, who genuinely recognise that many providers across the sector may require some form of financial support as we progress through recovery. And what we want to do is to understand what will be required to make your businesses more viable and sustainable. And we'll be engaging with our members over that in coming weeks. So to recap, childminding settings will be allowed to reopen during the first phase of recovery, but nobody can provide a precise date at this time. The collective aim at the moment is also very much to try to provide as much advance notice as possible, so as to allow time for preparation rather than being a sudden overnight change. Now, we will, of course, as we've done throughout the outbreak, share information with you as soon as it's available and appropriate to do so. Finally, to those of you who are closed just now, I would like to stress very, very strongly that the decision to reopen will be voluntary. There is absolutely no requirement to do so. And if you have any pre-existing illnesses, that you should continue to put your own health first. Stay well.